As we said, we've had 3 straight record-setting days of COVID-19 cases, 55 on Thursday, that set a record, then 60 on Friday, which set another record, then 73 cases yesterday on Saturday. Lieutenant Governor Josh Green joins us now with more on what's being done. Good morning, Lieutenant Governor. How are you doing this morning?
Good morning. Worried about our people because of the storm and COVID, but we're going to be okay. Lots to talk about.
Now, were you shocked about these 3 record-setting days?
Not shocked. Expected increases. The increases did exceed my worries. And remember, there's more cases out there that we don't capture because not everyone gets tested. We're going to see more of this going forward. It's going to be time to take action and kind of take a step back again, I believe, this week. But I am concerned about these numbers.
Now, when you say take action and step back, has that been discussed already with the governor and state officials?
It has been discussed. In fact, discussed at great length. Because of the storm, because of Hurricane Douglas or Tropical Storm Douglas, depending where it touches, we have to make that our top priority at the moment because life and limb are on the line with a storm like this. But early this coming week, I do think you will see some probably very sensible half steps back so that we decrease some of the social interaction. The Department of Health was absolutely on the mark. The 4th of July festivities, activities, some of which were very ill-advised, like big events and street fairs and so on, that caused primary spread and then secondary spread from those hotspots. And that's why we've got 800 cases in the last 30 days. We only had 800 cases in the first 5 months. So that's what's going on.
So the discussions, have they been more on the businesses that opened up last that might get put back on being on pause?
Well, I think that the first and most important thing will be to go to smaller gatherings again. Gatherings of no larger than 10 people and people staying in their bubbles, socially distancing, like Dr. Park and Bruce Anderson say all the time. That's the right thing to do. You got to go back into those bubbles. You have to not be in large groups. I think the important things will be that we will diminish some of those large social gatherings and social interactions. I would not be surprised to see some rules take a step back at beaches. Probably should only be there with your family, if at all. And then, of course, we have to deal with some of the spots where more people were gathering. So we'll make recommendations on all of these things, I'm sure, including restaurants, gyms, bars. Everything will be addressed. But the best thing to do is people should look at it from their own family standpoint. Do not let spread come into your family. Do not spread it to those that you care about. And the only way to do that is to stay with a mask in your own social circle. Do not have any large gatherings.
Now, with these record number of cases, are these considered in big clusters, or are there a bunch of small ones?
Well, that's the concern. It's been mostly small clusters. I would be a lot less worried if we had 73 people all associated with one particularly stupid event. But because we've had like 35 little 1- and 2-person clusters, that means there's pretty wide community spread. It means it will be more difficult to get a hold of. And Bruce was right when he said yesterday that there's probably going to be some extra spread because those clusters will have loved ones that they're living with. They will have individuals that they spend a lot of time with that are maybe not in their family but sit next to them at work. Those are the kind of spreading and clusters you'll see. So unfortunately, it is community spread. Now, let me say something positive. Every other state in the country would still be grateful to have the numbers that we have. And I convened an emergency meeting of the top hospital executives on Friday afternoon, and they have not seen a terrible surge yet at the hospitals, which is very good. But that usually comes 2 to 3 weeks after a surge. So I expect come about, mid-August that we are going to see some surge in the hospitals.
Now, the Department of Health also is seeing a spike in young people. 15 people under the age of 18 have tested positive for the virus. Does that show that this virus just does not discriminate?
The virus definitely does not discriminate. It loves everybody that can cough or sneeze or breathe on you. So this is the kind of circumstance where we in the medical field say young and vulnerables, and that's young people who are really not manifesting disease very seriously, for the most part are doing just fine. Yet they are vectors to spread it, and when they do large bike events and in giant, like the street festivals are a bad idea, that's got to stop. Certain things, even though we want to return to normalcy, we have to realize that we can't yet. That's why we're having surge, and it's going to result in a secondary shutdown. Maybe not a full shutdown. Let's hopefully just be able to ratchet it down and be safe and go for 2 weeks at a time. But that will likely jeopardize when the schools can open. You know, parents are going to be very concerned. You know, teachers are going to be very concerned. All of these things have consequences. But young people, you know, you have to remember you're wearing a mask, not just for yourself, but for your kupuna. So please, everybody do that. If you're just out walking alone, even then it's probably best to have a mask. I can't say that there's no risk, but anytime you're near anybody else, you have to have a mask on because you will otherwise spread the virus.
And you touched on it just a bit, but the Department of Education, with these younger people getting it, that must be a very huge concern with their reopening plan for August 4th.
It's a giant concern. I was with a principal last night and a school teacher last night. Both of them had concerns, interestingly different concerns. The teachers feel that they need a little bit more support and more planning time to get ready for what will have to be very, very diligent social distancing. Otherwise, they will catch it from kids and or spread it to the keiki in their classrooms. The principals have concerns because there's such a vast array of desires from families. Some families want to just be totally safe at home and have distance learning. Others really need to get their kid back in school some of the time so they can go back to work. But they all felt that it was just a little bit too dangerous. So let's be calm, definitely conservative so that we get this number back down and avoid what has happened in many other places, which is the surge is too big for the Department of Health to track. I was really pleased to hear that they are getting up to 400 tracers now. It's not the only solution, but it's certainly a big part of it.
That's right. The Department of Health said that they have 400 people who are now trained in contact tracing. I guess the bigger question is, how do we control and put out these fires?
You put them out one by one, and it's just really diligent, hard work by people who have been trained now by the university and Department of Health. They go and they wrap their arms around each case. They trace between 6 and 20 people. The people that are high risks or high contact likelihood, those guys get tests. After they've got their test, they go into quarantine until it's negative. And that's how you put the fires out and how you curtail the numbers gradually back down into the low numbers, the teens, and then snuff the fire out. But it takes work one by one because you can get one spreader, touches a couple other people, and before you know it, it's 50 cases.
Now, with the state bracing for Hurricane Douglas, what are your concerns, especially about the shelters?
Well, the city and county has been on top of it. Much credit to them. They've opened the shelters. I believe there's 13 shelters. There was some initial desires to open more of them, but thank goodness the storm appears to be, although we have to be totally safe and cautious, don't let your guard down, appears to be passing the larger population of Oahu right now and does not look to be tragic, right? So people should stay at home. That's the safest place to be as long as you've got a good structure. We will socially distance at the shelters if necessary, and we will, believe me, be on our toes if we have to open up more facilities. I worry, though, like anybody else. You've got these incredible workers at the Red Cross and the city. Those guys are going into work. They're going to be mingling with other individuals somewhat closely. Of course, we could get small outbreaks from that too, but I don't think so. I think that they are all going to be very careful. They've been well instructed to socially distance and wear masks, not to share water and so on. I think it's going to be fine, but let's get through this storm in the next 36 hours first.
Now, the DOH, they will not be conducting tests today because of Hurricane Douglas. How would that affect the numbers moving forward? Will we see like a dip and then a spike again?
I think what will happen is you'll see an artificial suppressed number of cases by about 20%. So in your minds, it just probably 20% higher than whatever we report tomorrow and then Tuesday, because a lot of the tests are still getting run by the private labs and that won't be curtailed. But also a lot of people will not go out for tests. They will not see healthcare providers. So probably you're going to see slightly lower numbers Monday, Tuesday, and then you're probably going to see a fairly big number, a robust number on Wednesday and Thursday. What I will do is probably average it out over the week so that people can get an expectation of where we are as compared to previous weeks. Like I said earlier, though, 800 cases in this last 30 days and 800 cases total in the first 150 days. So we have all these extra cases now that we will have to handle. We will, of course, see about 10% of people require hospitalized care. So we're in for some significant health work, but that's what we're here for. We're here to try to make sure people are well, treatments are better, The case counts mean a little less to me than the hospital counts in general, and people will go to the hospital if they're sick.
Any final word as we brace for Hurricane Douglas?
Just be very safe at home, everyone. Be very safe. If, however, it's a storm that requires going to a shelter, go. We have to triage the need, and that is our most acute risk. So definitely go if you're feeling that you're unsafe in your home. I do hope and pray that the storm will not hit us hard. We're really, saying a special prayer for the Kauai folks, because as we see the way this storm is going, and you guys have reported on it excellently, it's headed that direction too. But let's hope that the winds do come down to tropical storm level, and then we'll turn all of our attention back to COVID this week, because that's also a storm. It's a storm that we can control, however.
All right, there you have it, Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. We appreciate your time for the great information, and stay safe.
You too. Take care, guys.